be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us is Dr. Robert Popovian in Washington, D.C. He's a pharmacist, an economist, and the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me, as always, is my good friend Ben Blanc from the heartland of the United States, Indianapolis, Indiana. He is the Director of Digital Production and Engagement at GHLF. How are things going, Ben?
Well, busy as always, Robert. Between the news we've been hearing about the CDC lately and the ongoing debates about vaccine recommendations, there's no shortage of headlines to keep up with. But on top of that, we've also been working on a project that feels especially timely, and that's what we're talking about today.
Today, we're diving into the results of a COVID antiviral access survey that we did. It was a national study we launched earlier this year through the Global Healthy Living Foundation, and we're going to be discussing the results from that study.
Yeah, it's a survey that you, Robert, myself, and a few of our colleagues worked on. It looked at how patients, especially those living with chronic conditions, experienced access to oral antivirals for COVID-19. So we'll talk about what the data shows, why it matters now that federal support has ended, and what policymakers and providers can do to protect access moving forward. So let's get to it. Robert, let's start at the beginning. To set the stage, can you give our listeners an overview of why we launched this survey and what we're hoping to learn about patient access to COVID-19 oral antivirals?
We launched the survey for two reasons. One is because, as we know, and we've discussed this multiple times on our podcast, vaccination is the best way of prevention. However, the reality is that certain individuals, due to discouragement from the federal government or other reasons, refuse to get the COVID vaccine. So therefore, the alternative is when they get sick, they need to have something to treat their illness with regards to COVID. So that's the primary reason. We wanted to know what those treatment access issues look like, the patients have access to it. And the second reason we did it is because, frankly, there was a massive change that occurred earlier this year. Since the antivirals came into the market for treatment of COVID, the federal government has covered it with zero out-of-pocket costs, and we wanted to know if the access has been good. Now, the survey was conducted prior to the removal of that policy. So we want to see how it is before, and most likely, Ben, we're going to have to do the survey maybe in a year from now and repeat the survey and see how the access has changed, frankly.
Yeah, thanks, Robert. That's really helpful background. Now, one of the striking findings was the gap between awareness and actual prescriptions. So the survey showed that nearly 9 out of 10 high-risk patients were aware of oral antivirals, yet only 56% were actually prescribed one after testing positive. So my question is, what does this gap between awareness and use tell us about the current state of care?
Couple of things. Number one, remember when we survey patients, our patients have chronic diseases, and majority of them are immunocompromised. So these are patients at risk. So they are chronic disease patients who are at risk for severe outcomes if they get the COVID infection. And even though there was a large awareness among the surveyors that the antiviral was available, but as you point out, maybe a little bit more than half were prescribed the antiviral. And majority of the time, they didn't receive one because of two reasons. One, they were late to the party. That means they didn't have access to a testing the diagnosis was made fast enough for them to qualify for the antiviral. But the majority of the time, when this is something we can delve into more further, is that their healthcare professional, whoever they saw, whether it was a nurse practitioner, a physician, a pharmacist, whoever was basically responsible for prescribing it, decided for some reason that they didn't need the antiviral, that their severity of illness was not severe enough for them to qualify for taking the antiviral drug.
Yeah, so we really see a gap between knowledge and action. And another interesting finding was the concentration of prescribing around a single antiviral. Oh, and actually, while I think of it, we'll, of course, drop a link in the episode description for our listeners to access the report, Robert, that you put together with the highlights of the survey results. So make sure to check out the episode description. Yeah, Robert, the survey found that the vast majority of patients who did receive an antiviral were prescribed one specific treatment. So, what does this concentration around a single option tell us about prescribing practices and patient access?
I think it tells us one thing and one thing, which is the primary reason physicians prescribe this medicine, which is highly concentrated into one of the two drugs, is because it was the first in the market and frankly had the most robust data when it came out. Physicians and pharmacists and nurse practitioners got comfortable with it to prescribe it. Again, I don't think it tells us much more than first to the market type of an environment that we function in the pharmaceutical market. That's always true with other therapeutic areas too. Whenever you're the first into the market, you capture majority of the market share.
And beyond prescribing patterns, the survey uncovered missed opportunities for timely care. So let's talk about that next. The survey revealed some missed opportunities, with 15% of patients saying their provider never discussed antivirals with them, and 11% unsure if they were even eligible. So, what does this signal about communication between providers and patients, and what could be done to help bridge that gap?
Definitely education and insistence. I mean, Ben, besides the healthcare professional not discussing the availability of antiviral or even the patient being unsure that they're eligible, those determinations should be done in consultation with a healthcare professional, especially the latter part. If you're a patient and you have tested positive and you're not sure about eligibility, that should not be your call as a singular entity. You should be talking this out with the healthcare professional. I think the more worrisome thing, though, going back to our original comment, was that a lot of physicians who did not prescribe the antiviral felt that the patient sickness was not severe enough for them to require them for taking an antiviral, even though these patients had all tested positive for COVID. They all had a chronic disease, and majority of them, if not almost all of them, were immunocompromised. So I think we need to go back and really do two things. Number one, educate patients that if you've tested positive and you're not sure, you still need to have this conversation with your healthcare professional. You should not be up to you to judge whether or not you should be getting the antiviral solely. It should be a decision you make with your healthcare professional. But the second part is education of healthcare professionals. I mean, again, reminder, we don't deal with your average patient population at GHLF. All our patients have a chronic disease and majority of them are immunocompromised.
Well, thanks for that, Robert. And well, I don't want to be a Debbie Downer. So now on the flip side, there were some encouraging signs in the data. So let's talk about that. On a positive note, 91% of patients who were prescribed an antiviral took it as directed. So how important is this level of adherence in determining real-world effectiveness and preventing severe outcomes?
It's a good sign that patients are listening to their physician and following instructions of their pharmacist and physician on how to take the medicine. So that's a good positive sign. And it also tells you that patients who sought out the antiviral who were tested positive were motivated to take these medicines to get better. Again, does the antiviral cure the disease immediately? No, but it definitely, the evidence shows that it shortens the time interval that you're sick and it reduces the severity of the illness. Those are the reasons we basically promote the antivirals as healthcare professionals for patients. It's not that we think that it's going to completely cure the disease, but it reduces the severity of illness, and that's super important for the patient population that, again, we're talking about chronic disease patients who are primarily immunocompromised.
Right. Well, thanks for that, Robert. And well, you kind of alluded to that at the beginning of the episode, but the survey was conducted while antivirals were still free, widely available, times were different, and the situation has shifted since then. So unless our listeners live in a cave, they must have certainly heard about all the news about the CDC or updates made to vaccine recommendations. But now that federal support has ended and that COVID vaccine recommendations have been updated, patients may face new barriers around costs, insurance coverage, and access to testing. So what are the risks if these barriers grow, especially for high-risk populations?
Well, Ben, I will add one more thing. When this survey was done, we still have relatively an easy way of getting testing, which is super important on this because you have to test positive for you to actually take the antiviral, right? Without the positivity of the test, nobody's going to prescribe you that. Again, majority of the patients, and remember the survey goes back for 2 years. We asked the patients if they were diagnosed for 2 years, up to 2 years ago in the beginning of the year with COVID. And during that period of time, testing was widely available and free for patients to be able to access it. So you're absolutely right. So there's going to be some changes happen. Tests are not available for free. They're not widely available at all, if any. Testing is not available. And the second part is that the financial support from the federal government has ended. So if you show up to the pharmacy and you require that antiviral, depending on your insurance coverage, whether you have federal, through Medicare, through Medicaid, through private insurance, you may have some financial responsibilities that you have to meet for out of pocket. So that may discourage patients from taking it. That's why, again, when we started this podcast, we talked about how we probably need to repeat the survey a year from today and see how antiviral access has changed, if it has.
Well, one thing we know is that access isn't uniform. Some groups have been hit harder than others throughout the pandemic. So we know that COVID-19 disproportionately affects communities of color and vulnerable populations. Based on the survey results, what equity concerns do you see around antiviral access going forward?
Anytime you have access challenges, minorities, whether it's ethnic or racial minorities, are affected significantly more because of the economic issue. They're generally poorer, their economic outcomes are not as robust as white patients. So the portion of them being impacted is going to be significantly more with regards to access barriers. And part of it is financial barrier, and whether it is out-of-pocket costs for the antiviral or the testing costs that now exist that patients are not getting the tests for free. So yeah, it's a problem that we're going to see. And remember, the other thing is minority patients, especially African Americans, suffer from more chronic diseases and severe chronic diseases and disproportionately probably more immunocompromised. So again, the problem with that is that the people who need it the most probably going to have the highest barriers of accessing life-saving medicines, like every other medicine that we see among the minority patients who are economically disadvantaged.
Well, that actually brings us to the big picture takeaway. If you could give one clear recommendation to policymakers and healthcare providers based on this survey, what would it be to ensure antivirals remain accessible for patients who need them the most?
So if I was giving policymakers a recommendation, it would be don't discourage people from getting the vaccine, first and foremost, because that's the best way to prevent disease, right? Or reduce severity of illness if you get it. So my recommendation to policymakers is you need to really rethink about some of the rhetoric that's going on right now with regards to immunization in the United States, where it's really discouraging or scaring people from getting vaccinated. And although a lot of leaders, whether it's in the Health and Human Services or in the federal government, pretend that they're not scaring people, their rhetoric says otherwise. And they're truly discouraging people who are vulnerable from really seeking out the best way to prevent disease, which is vaccination. However, let's be in the real world. We have an administration, we have leadership within the HHS that is not fond of vaccination, and it's actively working against immunization of patients. So the reality is we're not going to be able to curb disease. Disease is still going to exist. So we need to then have the treatments to cure that disease or treat that disease. Therefore, we need to make it much more accessible and ensure that barriers such as financial barriers or administrative barriers don't get in the way, that patients do have access to these things. And that comes down to having tests available, that the out-of-pocket cost for patients is a reasonable amount, that they don't get discouraged from seeking out treatments when they get sick.
Thanks, Robert. And listening to you, my main takeaway is that the survey results make it clear that while awareness of COVID-19 antivirals is high, access and utilization don't always follow, and that gap can have serious consequences for high-risk patients. So as costs rise and coverage shifts, we risk creating new barriers and widening disparities. So protecting access to antivirals for the most vulnerable must remain a top priority for health policy. But what do I know? I'm not the expert. So Robert, you have the last word.
Ben, I think you summarized it well. I mean, there's 3 things here. Number one, we need to encourage people to get vaccination. Okay, vaccination is the easiest way to prevent disease. Number two, in our population, in the Global Healthy Living Foundation population, who are primarily, all of them have chronic diseases and the majority of them compromised, vaccination is the best choice. But if they don't get the vaccination done for a variety of reasons, then we need to have treatments available for them because the consequences are high with regards to mortality and morbidity if they're not treated effectively. So therefore, the number 2 and 3 things is that if we're not going to encourage vaccination, if we're not going to promote vaccination, if we're not going to make sure that vaccination occurs in this patient population, then the second and third part is that we need to have treatments available for them. And one of the most discouraging things that came out of this when we started this whole podcast was that a lot of these patients who tested positive ended up going to a healthcare professional who had a chronic disease, who were primarily immunocompromised, were turned away by the healthcare professional by thinking that, well, their disease is not severe enough. So education is the third thing that we need to do. Besides educating patients, we need to re-educate healthcare professionals.
Well, thanks for this threefold takeaway, Robert. Very clear. And that wraps up today's episode. So don't forget to subscribe to our podcast on Apple Podcasts, Spotify, or wherever you might be listening so you never miss an episode. And if you have a second, help spread the word by rating our podcast, writing a positive review, and sharing with your family and friends. It will help more people like you find us.
And if you have any questions, thoughts, suggestions, comments, you can always reach us via email at podcasts@ghlf.org. And you know what? If you have a great idea, Ben and I will invite you to our podcast. We've had guests before, and we would love to have you come on and tape a podcast with us on a topic.
And before you go, make sure you take a listen to some of our other podcasts on the GHLF Podcast Network. You can find all of GHLF's podcasts at ghlf.org/listen. He's Dr. Robert Popovian.
And as always, he's Ben Blanc. See you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.